Dear viewers, today we'll be learning about the thorax and how the different structures are organized within the thoracic cavity, the thoracic wall, and the bony and the soft tissue which are contributing in making my thoracic cage. Before starting, let me give you the orientation of this model. This is you're looking at the neck, and there you're looking at carotid vessels. This is my internal jugular vein. These are the common carotid arteries on both the sides. This is the larynx or the sound box, and in particular this is the thyroid cartilage, which is also famous with the name of Adam apple. And then you can see this thyroid gland. Coming down this area, we denote it as the root of the neck. And this is where you're looking at the sternum. And this part of the sternum is the manubrium part of the sternum. And this is the body. And then this down here is the xiphoid process. These three elements, they fuse in the later part of the life. And one thing which is important and worth knowing, the place where the manubrium meets the body of the sternum, and that makes manubro-sternal junction or angle of Lewis. And this is my jugular notch, and there you can see the two clavicle bones. Their sternal ends or the medial ends, they articulate with the manubrium part of the sternum, and down you can see on both the sides the first rib articulates directly with this manubrium of the sternum through the costal cartilage. And there you're looking at the second, third, fourth, fifth, sixth, seventh, eighth, ninth, and 10th ribs. Now when we talk about the ribs, we can classify the ribs by different ways. True ribs, false ribs, and now let's look into that. But regarding the detail of the ribs, there is a separate video which is coming up where we'll be learning in total detail about all the ribs. And there you can see in this model, if you come lower down, there you can see these costal margins. And what is worth mentioning, you can see that rib number 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10, out of these three, the lower three ribs means up till rib number 7, they have their direct articulation through their own costal cartilage with the body and the xiphoid process of the sternum. And respectively, the first rib goes to the manubrium and the second rib goes to the junction between the manubrium and the body. But the lower three ribs, rib number 8, 9 and 10, they don't have their own place on the sternum. Rather, they share their cartilage and they are articulating with each other, and then they are joining this 7th costal cartilage, and then they are having a shared attachment on the sternum where the body of the sternum is articulating with the xiphoid part. And together on both the sides they create a V-shaped area, and that is known as the costal margin. It has a lot of clinical correlation. If you look at the thoracic cavity in total, it's like a cone. The upper part is narrow, and as you go down, it broadens out. And then in the lower segment, again it goes tight. In the children, in the early part of the life, the diameter, the dimension, it is more of circular, but as in adults and older age, it becomes more ovoid. So now, and in between the ribs, the space between the two ribs, we call it intercostal space. And there you can see that the structure which is visible to you through this intercostal spaces, that is not the topmost layer, because this space is wrapped by, this space is traversed by the intercostal muscles, and then there we have intercostal neurovascular bundle. That has all been removed. And now you can see very clearly and very directly the lungs. Now, to look inside, we have to remove this. We have to split. You can see that my sternum has been splitted through this sternotomy. This sternotomy is the same when we are doing open cardiac surgery. We split the sternum like that so we can have a direct access to the heart and its coverings. Now we have removed the rib cage and part of the lungs. And now very clearly you can see the deeper structure. Number one and very obvious structure which has been visible in the middle, that is my heart. Its covering has been removed also. Its coverings are called pericardium. And then you can see this grayish white structure, a dome-shaped structure which overlies the liver, and that is my diaphragm. It is a demarcation between my thoracic cavity to the abdominal cavity. And you can see this heart rests on the diaphragm in the middle, and both the side we have the lungs. And if you look at the lung, this is the left lung and that one is the right lung. Left lung is slightly smaller than the right lung. Right lung has 3 lobes, left lung has 2 lobes. If you can pay attention, you can see a fissure here which divides my left lung, but for more details of the right lung, we need to look into when we'll be looking into the video of where I'll be explaining about the lungs. And now, just pay attention. This is primarily the part of the heart which is visible to you at the moment. That is the right ventricle of the heart. A very little contribution is coming from the left ventricle, but primarily the right ventricle is the thing which is behind the sternum. And you can see on the right side, there you can see the auricle, and this is partially you can see the right atrium. But left atrium is totally non-visible. And if you see the organization of the heart, the ventricles are in front and atria are behind. And now if you go up, you can see this bluish structure, that is my pulmonary trunk. And this pulmonary trunk, the job of this pulmonary trunk is to push the deoxygenated blood towards the lung for pulmonary circulation. And if you pay attention, we have talked about, this is my internal jugular vein on both the sides, and these are the subclavian veins. They join. On the right side, they join to make right brachiocephalic vein, which is short and straight as compared to left. Left brachiocephalic vein is going obliquely, is crossing over in front of my major vessels which are coming from my arch of aorta. And it's joining with the right brachiocephalic, and they are making superior vena cava, and superior vena cava brings the deoxygenated blood from the upper part of my body. What I mean to say by saying upper part? The head, neck and the upper limbs primarily. These are the areas which drain through, along with some drainage which is coming from the upper thoracic cavity. And now they all go and open into my right atrium. Now you can see this reddish big structure which is more on left side, and it's going backwards. That is my ascending aorta, which through its journey it goes and it becomes arch of aorta, and then it becomes descending aorta, which is also known as the thoracic aorta, and it runs in my posterior mediastinum. My ascending aorta is located in the middle mediastinum. My arch of the aorta is located in the superior mediastinum, and my descending thoracic aorta is located in the posterior mediastinum. What is this mediastinum? Mediastinum is the space between the two lungs. The details of mediastinum are coming in upcoming videos. So the heart and its vessels, they are located within the middle mediastinum. So now we have seen the internal jugular veins, we have seen the subclavian veins, we have seen the right and left brachiocephalic veins, and we have seen the superior vena cava. And there on the right side you can see the lung. Which lung? The right lung, its apex, its base. The other features are not shown in this model at the moment. And on this side you can see very clearly when my pulmonary trunk, it carries deoxygenated blood to the lungs, and there it divides off and it carries this deoxygenated blood, and there you can see these are the veins which are collecting the oxygenated blood, and ultimately they are bringing this oxygenated blood after the gaseous exchange into the left atrium of the heart through a pair of superior and inferior pulmonary veins which are not visible at the moment. Now you see the structures. After removing the heart, you see the structures in the posterior mediastinum. Quickly look at them. This is my trachea, which is bifurcating into right and left principal bronchus. And then you can see this esophagus, and there you can see the descending thoracic aorta. On both the sides you can see the hilum of the lungs, and at the base you can see the diaphragm. I don't know you can see inferior vena cava from this view or not, but for sure you can see the superior vena cava, and you can see the beginning of my arch of aorta. You are looking at the upper part of the trunk, and this area is the anterior thoracic wall, and skin is being placed. This is the upper part and this is the lower part. This is the right side and that one is the left side of this cadaver. Now we'll go step by step. We'll remove the skin and then we'll see what are the structures which are located inside. Incision has already been made. The skin has been removed, and now what we can see, the structures under cover of the skin and the superficial fascia. And there you can see muscles are visible to you. What is this muscle? This is my pectoralis major muscle, and you can see in between these intervening structures, these are my ribs. And this midline structure, that is the sternum. And there you are looking at the clavicle of the left side and clavicle on the right side. And this is the place where my clavicle meets with the sternum and makes sternoclavicular joint on both the sides. Now you can see these raised ribs. Now this is the location where I'm pointing out at jugular notch, and this part of the sternum is the manubrial part of the sternum. And then here we'll have the body, and down we have the xiphoid process. So now we have defined this pectoralis major. You can see its clavicular part. This part was attached to this clavicle and it has been detached from here. And this is the sternocostal part of my pectoralis major. So this whole muscle, and you can see the fiber converging. So this whole muscle is being reflected, and after reflecting this muscle, underneath what you can see very clearly, this is my pectoralis minor muscle. And you can see it's going towards my coracoid process to be attached there. And now clavicle is more exposed. We can see its sternal end where it's articulating with the manubrial part of my sternum. And then one very important thing, you can see these are the ribs. Now how I determine which rib is this? So there is a very important way, there is a very important method of counting the ribs, and that is one of the integral part when you are exploring any of the thoracic cavity for any of the procedure. So first of all, we have to isolate this sternal notch. Place your finger in the sternal notch, stay in the midline, and then start coming down. The first bump, the first raised area which you will find, that place, this place is nothing but my manubro-sternal joint, and this is also known as angle of Louis. And this place, at this angle of Louis, mandibulosternal joint, the costal cartilage which is attached belong to my second rib. So this is my second costal cartilage and this is my second rib. So you're looking at the second rib on the right side and you're looking at the second rib on the left side. Now, after we have established that this is the second rib, now it's very easy. There you're looking at the third rib, fourth rib, and then the space between these ribs is called intercostal space, and this space is being enclosed by 3 muscle layers. The outermost coast, you can see that these directional fibers, they are going downwards. That externalmost layer is my external intercostal muscle. Now, let's look inside this thoracic cavity, and for that we have made a median sternotomy incision, and the sternum has been splitted vertically. And then we have also made these 2 lateral incisions, and we have also made these inferior incisions so that we can remove the rib cage in different parts. And let's remove one by one. So first of all, I'm removing this lateral side. Then I'm removing this first rib. After removal of this, you can see the right lung, which is very nicely visible in its normal location. You can see the inferior border of my right lung, as well as you can see the anterior border of my right lung. And here, if you can appreciate, you can see this is my parietal pleura. The visceral pleura is almost adherent with my lung surface. And there, if we look up, you can see this superior vena cava. There is a slight rent in this superior vena cava. Why it has happened? Because when we are dissecting, this was adhered with the anterior chest wall. So while doing that dissection, there was a rent occurred at that level. And there you can see my right subclavian vein, my right internal jugular vein. They join to form a straight structure. And this structure is nothing but my right brachiocephalic vein. And if I have to look at the left brachiocephalic vein, I need to retract it a bit, and you can see this one, this blackish gray structure, that is my left brachiocephalic vein, which has an oblique course. And both of them, they join and they make superior vena cava, and superior vena cava opens in the right atrium of the heart. So now, if we go, and there you can see the diaphragm, and there you can see abundance of fat, which is just present in front of it. And everything is being adhered with that. So now what I'm doing, I have removed that big chunk of fat and I'm just separating out, removing this fat which has been quite in abundance in this area. And I'm just trying to remove this fat away so we can have more clear view of the right lung. Its inferior border, you can see very clearly. Its anterior border is nicely visible to you. And then you can see upwards. And there, behind the sternum, this area we call it anterior mediastinum. To look in more details, now let's reflect the other part. So for that, I'll be using this retractor. Let me place it here. And now you can see very clearly my left lung, its anterior border, which is very sharp, you can see that. It's quite nicely visible to it. And there you can see there's a notch that is known as cardiac notch. Why we call it cardiac notch? There you can see this structure, this conical structure. That is my heart. And if you can pay attention, part of it is in the right side of my sternum. A major portion is within the middle part or behind the sternum. And a sizable portion is on the left side. And this is the apex of my heart. And corresponding to that, the right lung, anterior border, the left lung, anterior border, there's a notching. That is called cardiac notch. And below to that, if you can pay attention, you can see that this is a tongue-like process. That's why we call it lingula. And now because of this notching, this part of my heart, it lies anteriorly related to my anterior chest wall. And this is where we can locate the apex beat. Now, what you need to look into that, you can pay attention. My heart is covered by a lot of fat. And we all know heart has been enclosed in two layers. One is a fibrous layer, another one is a serous layer. So this fibrous layer is called, these are the coverings of the heart, so we call them pericardium. And now I'm lifting this fibrous pericardium. I made a rent here, so now I'm moving. You can see now the fibrous pericardium has been reflected, and you can see very clearly the heart has been visible to you. And this is I'm moving the layers of the fibrous pericardium.